What is the difference between saline implants and silicone gel implants? Well, these are some examples of silicone gel implants. But interestingly, saline implants have a very similar outside shell. Matter of fact, the shell is pretty much the same. And so sometimes people think, oh, I'll get saline implants because I have strong feelings that perhaps I have some issues with the idea of silicone. But in fact, they're both made of silicone. The shells are about the same. The difference between the two implants is actually what's inside the implant, the fill. So saline implants come with this shell empty, just like a flat balloon. And then during surgery, the implant is filled with saline solution. So we call them saline-filled implants. And so just the same as if you got an IV fluid, you know, the IV fluid bag, that's saline solution. That's what we use to fill the implants. Saline implants are great. They actually do a very nice job of providing an augmentation. I think silicone gel implants are a little softer. This is a silicone gel implant. This is filled with what we call cohesive silicone gel. And this cohesive type of implant has been back on the market since 2006, 2007 era. And so this is not the same implant you would have gotten, say, back in the 70s or 80s. So I always say, hey, this isn't your mama or your grandma's implant. This is the newer version, you know, gel 2.0 or whatever you want to call it, which is more cohesive. You may have heard the term cross-linked or gummy bear. All of those terms apply to any silicone gel implant on the market. It doesn't matter the shape or the brand or anything. They're all of this type of gel. And the benefit of that is it is nice and soft, which is what I was alluding to earlier. But also the gel itself is sturdy enough that if you were to cut this implant in half, the two halves would sit there just like Jell-O. So the gel itself isn't a liquidy substance like it sort of was more back in the 70s, where you heard that people would have problems because if they had a small issue with the shell breaking, that this liquidy stuff would sort of come out and go everywhere. I've been doing breast surgery a very long time, well over 20 years, and I can tell you I've taken many of the older implants out of ladies who had their implants done way back in the day. These newer implants have the much more sturdy, cohesive gel. Now, all implants wrinkle and ripple a little bit, as you can see. The better coverage you have, meaning the more natural breast tissue you have, the less you're going to see and feel wrinkling and rippling. But that happens with both salines and gels. Keep in mind, it's not hanging in the air like when we demonstrated to you. You know, once it's inside of you, it's a little bit more like this, and you're not seeing or feeling that as much. But for people who have very thin skin, you might see or feel some of that wrinkling and rippling. But that is the difference between saline and silicone gel implants. It's not the outside shell of the implant, it's actually the fill.